Hi, Dr. Heidi. Welcome back to another one of our Tuesday chats. Today we are going to talk about the big P, is what I call it, because it is. It's something that gets thrown around a lot. Like, my dog's got pancreatitis, and it always sort of stops me in my tracks. I'm sort of like, oh God. And I used to think, what does that mean? What does that mean? And because a lot of people ask, can you take doggy daily with pancreatitis? And it's a stressful thing for a dog owner. And I've learned everything I know about this from you, Heidi, and us talking about this on email. So it's going to be awesome to share your knowledge with our followers on this. So I'm going to kick off with our first question is, what is pancreatitis and why is it so commonly misdiagnosed or missed by owners?
So pancreatitis is the pancreas.
Yeah.
And itis is infection or inflammation of the organ of digestion that is the pancreas, pancreatitis.
Yeah.
It's often misdiagnosed because it can mimic other issues. And there's a spectrum of disease. So as a practicing vet, it's one of the most common emergencies that I see in general practice, and it can be life-threatening. So we take it very, very seriously. A severe infection of the pancreas can set up an awful chain of events that your dog can even end up diabetic after they've had pancreatitis. They can be extremely unwell right through to sepsis. Inflammation of the pancreas is incredibly painful, where these dogs will shut down from pain. They will vomit, they'll have diarrhea. Hemorrhagic pancreatitis is where the organ, it's red, inflamed, obstructed, and the dissolving chemicals that it would normally produce eats itself because it can't get out. And that's a terrible situation for the dog.
Wow.
So it's a very, very serious disease with serious sequelae. So very, very important, particularly for certain breeds of dogs who are overrepresented in our veterinary emergencies for being diagnosed with pancreatitis, such as the Schnauzer. So if you have a miniature Schnauzer, this is something that you really want to get right from the beginning to set your dog up for success, to avoid pancreatitis at all costs in your dog.
So what am I looking for? So what am I doing at home when I see my Schnauzer? Sorry to isolate the Schnauzer, but we'll talk about the Schnauzer. And say, so what's my Schnauzer doing? Or how am I going, oh, that doesn't look good. I think it might be pancreatitis.
So on the mild end of the spectrum, these dogs are fussy.
Fussy, okay.
So they're picky with their food, because what happens is they eat food, goes through their stomach, and then they have this burn reaction and they think, oh, gut's ache. They'll often pull their feet forward and stretch backwards and groan. So that's quite a hallmark of disease of pancreatitis.
Wow.
Vomiting, diarrhea, they're lethargic, they're often dehydrated.
Wow.
And so they're just a bit meh. Right through to dogs who are clinically just about in collapse.
Wow.
So hypovolemic shock, reluctant to move. These dogs do not want to get out of their bed and go and do anything. And they're in that classic prayer position because they're pulling and trying to stretch that pain out of their tummy with having their legs stretched forward. So, and for some dogs, a very, very high fever. So 38.5 is normal. So these dogs will have a high fever of 39.5, 40. I've even seen 41 and 42. And at that point, those dogs are at risk of having a neurological overload or a seizure from hyperthermia from the fever. Very, very serious. And septic shock, which is dangerous.
Are there foods that are big triggers?
It's a constant point of research.
Okay.
There are often common things that we see as an emergency vet that owners say that the dog has got into that has triggered the pancreatitis.
Okay.
So often it's a very sudden high-fat meal. So we'll see it on a holiday, we'll see it where people have got the barbecue out and the dogs have got into the sausages or the fat or the dripping or the bacon, very rich table scraps, and then often leftovers from the Chinese takeaway. So I've got a couple of theories about that. Yes, it's fact, but interestingly, it is also a very highly processed meat, often injected with sulfur dioxide. So those cured meats, the ham, the bacon, the sausages, have all got processed chemicals in them so the meat doesn't rot. It improves shelf life. They're injected often with colourings to make them look bright red forever.
Yeah.
And we know that those things essentially, and this is my words, not necessarily every veterinarian, but those pickled foods pickle the pancreas. And those things are linked very clearly in human research to pancreatitis and pancreatic cancer. So my theory is that the same applies, that sulfur dioxide is an absolute no. And things to avoid. Other risk factors for dogs is if the dog themselves is obese or overweight. They're not digesting food normally successfully, and so therefore it's all sort of gummed up.
Yeah.
Dogs with certain diseases, so if they've got diabetes or Cushing's or Addison's, high blood triglycerides, if they're on certain medications including steroids, absolute sitter for pancreatitis because it suppresses their immune system. And it lowers the body's innate immune system. We were talking about their little Pac-Man immunity munches that come along, their white blood cells and their lymphocytes that would help mount an immune response. They're taken out by the medication and therefore more likely to get infection of the pancreas. And then a dog that's previously had pancreatitis may have scarring, inflammation, or a less ability of that organ to do its job, be a bit gummed up, and so they're more likely, if they've had one episode of pancreatitis, they're more likely to have repeat episodes of pancreatitis.
Yeah.
And then you've got your breeds that are very high risk for pancreatitis.
Yeah, so we just mentioned that next chat on breeds. So schnauzers are high risk. What are some other breeds that are high risk of pancreatitis?
So miniature schnauzers, our Cocker Spaniels are high risk. Our Yorkies, our Yorkshire Terriers. I often see mini poodles. You know, a lot of mini poodle owners will say to me, oh, my dog's really fussy over food. And I say, oh, gosh, let's have a look at that. That might be pancreatitis. I say, oh, no, they've always been fussy.
Yeah.
Maybe they're fussy because there's an issue with their organs of digestion. So we like to dig into that a little bit. And then, of course, we find the triggers of food that will often make those things grumpy, and then Cavalier King Charles Spaniels.
Okay.
But saying that, any dog can present with pancreatitis, including big obese Rottweilers.
Yeah, okay. So these are tailored, so like there are some common ones, but really it's for anyone. Like it can hit any dog. Like you're not in the safe zone if you don't have one of those dogs. Once it's been diagnosed, what does like recovery look like? Like what are you having to change in the diet to keep the dog, happy, healthy, safe without new triggers?
So from a holistic point of view, you do not want to repeat the same trigger factors that led to disease. So if it was sausages that gave the dog pancreatitis, if the dog's overweight, you want to sort that out. If it was because they scavenged in the compost heap and got into all of the leftovers and chicken scraps, then you've got to sort those things out. Recovery depends on if it's mild pancreatitis, moderate pancreatitis, or life-threatening pancreatitis. But there are similarities with treatment. So intravenous fluids is a hallmark of treating pancreatitis because these dogs are very, very dehydrated. So they're acutely unwell. They've got often shock. They've been vomiting. Their sodium and potassium is out, and fluids are key. We use an additional super antioxidant of vitamin C, which not many vets do, but in my hands, it's been highly, highly successful. And I know there are other holistic vets that do so, and obviously in athletes, we use that quite a lot. pain relief is really important, and I often use the opioids because they're much more gentle on the kidneys and the liver. If a dog is dehydrated, we don't want to be using non-steroidal anti-inflammatory drugs. But in my hands, the pethidine, morphine, Temgesic are all very gentle for a really painful tummy, and that's one of the most humane things we can do for our pancreatitis dogs is just give them some relief. Anti-nausea medication because they feel really sick and nauseous and hence the vomiting. And then early correct nutritional support once we've got the vomiting under control, and then very careful monitoring and change of food. So easily digestible food, keeping food that is recognised by the body as being more whole food. And this is where some holistic vets might vary a little from some, classically trained GP vets who may prescribe highly processed kibble-based food or highly processed canned food. My experience, I can only talk about how my patients have done. My patients have done very, very well on a fresh blend of a veal meal that is lower in fat, but it's got all the anti-inflammatory food built in. It's got green nut mussel, it's got Himalayan rock salt, it's got some, veggies and some herbs in there, and it meets their protein requirements without excess fat, and it tastes yummy. So these dogs are not anorexic. They're really keen to eat a body-warmed food. They're not put off by, dry old biscuits. That's my personal experience. But I have had an incredibly high success rate with pancreatitis. So before we used intravenous vitamin C and some other natural foods that we've used, death rates for pancreatitis could meet 50-50. And since we've started using something as basic as a little bit of parsley, which is vitamin C, vitamin A, chlorophyll and iron, intravenous vitamin C and some fresh food, we haven't had a single unexpected death in, we think, 10 years.
Wow. Yeah.
So it's, it's not a little bit better in my hands. It's been massively
awesome.
So parsley is something that most people can easily have access to. But vitamin C, very helpful, and it's inexpensive. And there's no reason that people, other than extreme renal failure, because it's a mild diuretic, makes them drink more water. And always, every dog's an individual, so, still have a chat to your vet. But in my hands, that was one of the first holistic things I started doing, and it's been successful for treating pancreatitis. And then the supplement.
And then the supplement, because we often, when we are talking to customers when they're wanting to come on board with Doggy Daily, they are often let me check this with my vet. I think pancreatitis dog owners are working closely with their vets. Yeah. So I guess obviously having a healthy gut and a microbiome that's aligned is going to be essential because you want to keep your dog happy and healthy, low fat, and everything right. And I guess the biggest question that ties into that for us, because obviously Doggy Daily focuses on microbiome, is Doggy Daily safe to be fed to dogs with pancreatitis? Because our biggest pushback sometimes from customers is that I'm not sure about the Brazil nut because it's fatty and I don't know if my dog can have that.
So when your dog is in clinical pancreatitis, it's incredibly scary.
Yeah.
And because it's a life-threatening disease, it's not necessarily the right time to put, anything new that's in there. So if you're not sure, just obviously wait. And each dog is an individual, and the care of a dog around pancreatitis is a really important time that you and your vet work together as a team, side by side.
Yeah.
But all things being equal, do I treat my post-pancreatitis dogs with turmeric, probiotics, seaweed, 53 vitamins and minerals, vitamin C, and whole foods? The answer is yes, I do. And I've had a lot of success. So I'm just sharing my personal experience and other people's personal experience clinically. For their individual patient, they still have to talk to their vet. But certainly, I have used those things to not repeat the cycle of inflammation. Turmeric is a very old ingredient for anti-inflammatory. And in many ways, it's far safer than a lot of frequently prescribed non-steroidal anti-inflammatory drugs. So non-steroidal anti-inflammatory drugs can be catastrophic in terms of causing problems, gastric ulcers, which can be life-threatening in themselves, bleeding in the gut, and they're processed through the liver and the kidney. And if the liver and kidney are already under stress, you don't want to be adding chemicals that are going to increase the liver's job because it's already overloaded. So that's where I use turmeric, because I've found it to be incredibly safe, even in my senior patients, even in my geriatric patients, and very well tolerated by my post-pancreatitis schnauzers, to which I have no recurrent, I'm just trying to think through all my other patients, no recurrent, once I've changed their food and their management, that they don't keep getting pancreatitis, which is news to a lot of schnauzer people who just think that that's the way it has to be. It does not. I've had many schnauzers that are nearly dead with pancreatitis and multiple bouts, and we have successfully got them out of that repeat episode of disease. It is possible. There is hope. That doesn't have to be their future. Neither does being diabetic.
There is. There are ways to treat this. It can even be natural if it's in that sort of level of treatment. Whole foods,
provided the dog's stable, and the product's low in fat, then it can be appropriate as a normal part of the dog's overall diet. So it's vitamins, it's minerals, it's antioxidants, it's prebiotics and probiotics, and low fat. So it's unlikely to create an additional demand on the pancreas. It also supports gut microbiome. So in many of my patients during recovery, I found it beneficial.
Absolutely. Yeah, and obviously everything should be tailored. Like, you should work with your vet. Like, if you're unsure, or if you're worried, the vet that you're working with that's tailored to your dog is the best person to be talking to. Yeah. Well, I think we've just covered pancreatitis so well there, Heidi. I loved all of that information, and it was so good to get that out in that flow. Is there anything else that you want to add about pancreatitis, or are you saying this is a more common disease than ever before, or is it on the rise, or is it
definitely? I mean, I've started my vet care in sort of 89. I'm trying to think, and we didn't see that many. As more and more processed food, highly processed food, has come along, and as obesity has increased in breeds, definitely pancreatitis has increased. And I think people have forgotten that dogs need fruit and vegetables. Balance is really, really important. So my holistic approach as a holistic vet, realising that I am classically trained, and I have adapted through experience and through following patterns of success, is that an approach including real food, maintaining a healthy body weight, reducing unnecessary inflammation, protecting that gut microbiome like your pet's life depends on that immune system, because it does, and avoiding dietary indiscretions. That's the long-term strategy for fighting pancreatitis and other diseases, chronic diseases, to reduce their risk, is that food is medicine and start with the basics.
Absolutely.
It's usually a trigger and a pattern that I've repeatedly seen as a vet of 27 plus years. And if you can crack that pattern, you can set these dogs up for success and lifelong health, not a recurrent situation where they're ending up in after hours and emergencies and in septic shock. And it's incredibly stressful for the owner to live in fear that their dog may die of pancreatitis. But the main thing I want to share with people is that there's hope. It doesn't have to be that way.
Yeah, totally. So, there is hope.
Using real food is a strategy. And as veterinary professionals, our clinical perspective is our own. Yeah. But I can only share that has been my experience, and I have hundreds and hundreds of patients who have not had pancreatitis again. So it is possible. There is hope.
Yeah, awesome. Oh, well, thank you so much, Heidi, for all your knowledge on pancreatitis, or the big P, as I call it. And yeah, we will see you again next week.
Thanks, Sammy.
No worries. Bye.